the role of psychiatrist in the psycho-oncology in future?
Even now and in future, the role is massively there. I would not be able to statistically say the number of patients, but most of them will be depressed and anxious. If you're not anxious after a news breaking to you that you're having cancer, there is something wrong with you. So you would be definitely undergoing the whole process. A lot of it depends on the word you used, psychoeducation, of making them aware about their emotions and what they're going through. The ones that move ahead of that, depending on the stage. So, for example, if you take a symptom or a sign of suicidality, there are different stages in which suicidality will be reported in a cancer patient. First will be when the news is broken. Then will be when they are undergoing chemo. Then will be a despairing situation where loss of autonomy happens. When things are not going right, and unfortunately recurrences. So even when you have gone through the entire thing and again after 5 years you get cancer, is not an easy thing to take. So I'm just giving you one symptom of suicidality which can come at different types. There are times in which the patient inter-episodically is completely normal, but yet suicidal. That time you will have to check for an underlying psychiatric illness. So a role of a psychiatrist or the psychiatry comes massively because medication will be required to correct this state of mind which is not normal. Once they are in a normal state of mind, chances of them responding to the onco treatment as well as all the other aspects will be far better. Just moving on to one topic that ma'am said about spirituality, especially in the onco-psychiatry area or onco-psychology area, I think it's extremely important because one starts questioning the purpose of everything, especially at that stage of despair as we call it. You are going to question, why am I here, what am I doing, and where am I going to go next? If there is no answer to that, again there will be that stage of let's hasten the death or let's move forward in that direction. Right now also we do get calls. There's a condition called as delirium, that is a confused state of mind due to the general medical condition, which is again about 20 times more common in a cancer patient. So we do need to correct that now and then to bring them back to normalcy in terms of consciousness, which is a very common phenomenon, but the commonest reported symptom is anxiety and depression.
Right, and you might have came across a situation because when we are talking to psychiatrist Dr. Ruta Sule, she told that there is one important aspect that a psychiatrist should take care